Drug therapy, lifestyle changes, and angioplasty have all been proven to help relieve the symptoms of coronary artery disease. But in the most critical cases, when restoring blood flow to the heart is urgently required, coronary artery bypass surgery can sometimes be a patient's best hope. Coronary artery bypass surgery, also called bypass surgery, is just what it says: surgery that bypasses a clogged artery by attaching a blood vessel above and below the blockage point. Because bypass surgery is a risky procedure, it is usually reserved for only the most advanced cases of coronary artery disease, such as when multiple arteries are blocked or when a heart attack has occurred.
It's really the last choice. I mean, we don't get called unless the cardiologist really doesn't feel that he can do an angioplasty, or that he doesn't feel that the patient will do well long-term with an angioplasty. So we really are seeing the patients that really have no other alternative.
To prepare for bypass surgery, most patients are admitted to the hospital the day before the operation. A number of tests is usually performed, such as an EKG or chest X-rays, to give the surgeon the latest information about a person's health. Patients are told not to eat or drink anything after midnight because the anesthetic used during surgery is safest on an empty stomach. Certain medications might also need to be discontinued before surgery. While the surgery itself is rather simple, the precautions that must be taken to protect the heart are extreme. During the operation, the heart is stopped for up to 5 hours, and its functions are performed by a heart-lung machine, also known as a bypass machine.
That bypass machine is taking over the function and sending blood and oxygen to the rest of the body, while we put a clamp and stop the blood flow to the heart itself. After we stop the blood flow to the heart, then we give this solution of cardioplegia, that potassium solution, and that causes the heart to become sort of dormant, basically. And it's during that time then when we do the bypasses themselves.
Before the heart is stopped, a blood vessel is removed from the patient's leg or chest, which is used as a graft to bypass the obstruction. Traditionally, a 10 to 12-inch incision is then made down the center of the chest, exposing the heart. One end of the graft vessel is attached to the aorta, the large artery leaving the heart. The other end is attached to the clogged artery, just below the blocked area. When the bypass is completed, the heart is restarted.
Once we're done doing the bypasses, we take our clamp off, and now warm blood goes back to the heart and goes down the coronary arteries and down the bypasses. And once that warm blood reaches the heart muscle, then the heart starts right back up again.
With the new artery in place, blood can once again flow freely to the heart. Since 1995, a different and less traumatic technique has been used to access the heart and perform a bypass. Minimally invasive direct coronary artery bypass surgery, or MIDCAB, requires only a small incision in the chest and allows patients to avoid the heart-lung machine. Candidates for bypass surgery should ask their doctor which surgical technique would be best for them. Bypass patients are normally kept in the hospital for 3 to 5 days after surgery for monitoring and recovery. During the recovery, patients are given a blood-thinning medication, such as aspirin, to help prevent clotting. Additionally, if the cause of the clogged arteries was a result of lifestyle factors, like high blood pressure or a high-fat diet, a cholesterol-lowering medication may be prescribed. When bypass surgery is successful, it will immediately impact a patient's quality of life by decreasing angina and other symptoms of coronary artery disease. But the journey toward recovery doesn't end with surgery.
Most people benefit from going to cardiac rehabilitation, a formal exercise program, for 3 weeks to a month after the initial event. just so they can get to know their bodies, they can start exercising under supervision, etc.
Oh, my goodness.
After recovering from surgery, patients will also need to take steps to ensure that their coronary artery disease does not recur.
I've said to people too, you know, how long their bypass surgery lasts is really going to be dictated by how good a patient they are. And I tell them, you know, you see those people out, you know, doing their brisk walks on cold, rainy days, and those are the patients that don't want to come back and see us. It's not who's good for the first 2 months, it's who's good 6 years later.
Coronary artery bypass surgery is only used in the most extreme cases of heart disease. While it can be beneficial, there is a slight risk of death. That's why doctors say the goal with coronary artery disease is always to catch it early, so that safer, less invasive measures can be taken, such as coronary angioplasty, drug therapy, or lifestyle changes. For The Answered Patient, I'm Dr. Gerald Chodak.